Okay, good evening, guys. I hope that we are okay. All right. Yeah, I hope that everyone is okay. Yeah. So welcome to pathology, topic one, which is inflammation. Yeah. So I've decided to divide this into two parts because it's a lot to cover in one night. So you might get bored. Okay, someone to confirm if you can get me. How's the reception? Okay, great. All right, so without wasting any time, I'm sure we can start. So when we're talking about inflammation, I'm sure it's not the first time we are hearing this word. So when you have an injury, you see that your skin maybe there's a bump that begins to develop. Then in that bump there's some fluid. Okay, so inflammation is simply a defense mechanism by the body by which it tries, which it succeeds to eliminate toxins and microbes, invading toxins and microbes which may cause harm to the body. So it does not only eliminate those toxins or eliminate those microbes, it will also eliminate the affected cells. I remember in the previous class we talked about the type of cell death. We talked about apoptosis and we talked about necrosis. So the type of cell death which you are expecting under inflammation is going to be necrosis. So that simply means that the surrounding cells are going to be affected. Okay, it's more like a blast. Yeah, then we know that inflammation, it's not specific. It can happen in any type of cell. So you don't have to forget that basic information we looked at last week, I think. Okay, so we're saying that it's a protective response intended to eliminate the initial cause of injury as well as the necrotic cells and tissues resulting from the original insult. Okay, so not insult for insulting people, no, but here we're talking about injury to the cell, any type of injury. It might be physical trauma, which might be burns, or it might be internal cell damage. So inflammation will be there to clear those necrotic cells as well as microbes. So it accomplishes its mission by indirectly diluting. So take note. I don't know if I can highlight. Okay. So take note. We're talking about diluting, indirectly diluting. So inflammation indirectly dilutes toxins, causing neutralization so that the harm can be neutralized. So you're going to come across a question asking you, does inflammation indirectly or does it directly dilute toxins? Please, inflammation does not directly dilute toxins. Okay, it's an indirect process. Due to inflammation, there's dilution of toxins. Okay, so during repair, injured tissue is replaced by regeneration. Okay, so we're talking about those tissues which have been damaged by necrosis. They need to be removed quite all right. Then a certain type of repair called regeneration. Okay, so there are types of repairs, and one of them is repair by regeneration. So this is the type of repair which occurs in cells that are able to regenerate. So some cells are permanent, and once they have been destroyed, once they have gone under inflammation, they cannot return to the original cells. Okay, so that's regeneration, repair by regeneration. Etiology, we know that etiology means the cause, and causes of inflammation are various. We can talk about microbial infection. So once microbes have invaded your body, let's say they have invaded your bronchi, we know that you're going to have bronchitis, which is inflammation of the bronchioles. Okay, so various microbes can invade your body. Examples, can talk about bacteria, most common ones. We can talk about viral agents, can talk about fungal agents, and etc. Then physical agents, we're talking about burns, we're talking about trauma, we're talking about cuts, as well as exposure to radiations. Other agents include drugs, toxins. We can talk about caustic substances like battery acid. Okay, so all these can lead to inflammation. We can also talk about example of drug. We can talk about anti-inflammatory drugs. So once you take a lot of anti-inflammatory drugs, you find out that your stomach will start having problems, maybe gastritis, due to the destruction of that lining. So yeah, you look at those type of drugs in under pharmacology. So some drugs can cause inflammation in the stomach. Immunological reactions. So immunological reactions are basically autoimmune reaction where the body attacks its own cells thinking that they are invaders. Okay, so this is most likely due to inheritance. Maybe if there's some relative of yours who had an autoimmune disease, you find out that even you are likely to have this autoimmune disease. Then the body is attacking its own cells. So for example, we have rheumatic fever or arthritis. Okay, so yeah, so take note of such examples because you are likely to encounter them maybe in a test, multiple choice especially. Then there's also genetic or metabolic disorders. I'm sure there's no explanation here. Example, you can talk about diabetes mellitus. You can talk about gout. Okay, so these are examples of genetic disorders. So what I can say, when you're studying pathology, take note of I would say almost all the details, because even right here on the etiology you might find a question, so you never know what's going to come. So just take note of small stuff, and I've tried by all means to summarize the notes. Okay, so inflammation, nomenclature of inflammation, you're going to find out, or you're going to notice that it always ends with its. It always ends with its. For example, cystitis, this is the inflammation of the bladder. Then we have bronchitis, which is the inflammation of the bronchi. We have otitis, which is inflammation of the middle ear. Then we also have dermatitis. Of course, this is inflammation of the skin. So every time you have been presented with a pathology question and you discover that you don't know that question, but in that question, a condition that you have been given is ending with its, just know that you are talking about inflammation. Okay, so this is one of the key variables or maybe key factors to identify questions. But of course, we have some exceptions to this rule. For example, pneumonia, which is inflammation of the lungs. Okay, so pneumonia does not end with its. So this is an example of that exception to the rule, saying that when you're talking about inflammation, a condition will end with its. We also have typhoid fever. This is also a type of inflammation. Okay. Okay, so acute inflammation. When you're dealing with acute, if you say something is acute, between acute and chronic, acute means that it is short-lived. That condition will not last for a longer period of time. So, for example, we are saying that acute inflammation can last for at least it can last for less than 48 hours. Then when we talk about chronic inflammation, you'll find out that in chronic inflammation, it will last maybe for weeks or even months sometimes. No wonder we are saying that inflammation, in as much as it is helping your body to get rid of toxins, when that inflammation becomes chronic, it might lead to destruction of those cells. So we're going to look in a bit what I'm talking about. So inflammation, acute inflammation can last at least 48 hours. Then it is also the immediate and early response to injury designed to deliver leukocytes to the site of injury. Leukocytes, I'm sure we are aware that we're talking about white blood cells here. Then the specific type of white blood cell which is under acute inflammation is the neutrophil. Okay, so the neutrophils, they are quite a lot in number in your body, and they are the first to arrive at the site of injury. So when they arrive at the site of injury, their function is going to clear invading microbes, as well as begin the process of breaking down necrotic tissue. As we said, we do not need that tissue. It has been destroyed, it has been damaged. We need to replace that tissue. Okay, so what you're getting from this slide is that acute inflammation will last for about 48 hours. Then it of course it is the first response after you are injured. It's going to be the first response, and its function is to deliver neutrophils to the site of injury. Those neutrophils, their function is to break down the necrotic tissue and also to clear invading microbes, of course, by the process of phagocytosis. Okay, so when these neutrophils, they fail to do their job under acute inflammation, when they fail to clear these microbes, they fail to break down necrotic tissue, that's when the condition becomes chronic. Then that's when you are expecting macrophages to be at the site. Okay, I'm having a bit of issue with my battery. All right. Okay, so cells under inflammation, we have all these cells, but of course, the major cells here, we're saying that under acute inflammation, they are going to be the neutrophils. Then under chronic inflammation, they're going to be macrophages. So in case you have been given multiple choice, and that multiple choice, and that multiple choice is saying that the first cells to reach at the site of inflammation, they are granulocytes. It's still correct because under granulocytes, that's where you're going to find these subspecies of cells, where you have the neutrophils, you have the eosinophils, you have basophils, and mast cells. Then the macrophage is a type of monocyte, and this type of monocyte falls under a granulocyte. I'm sure by now you are very familiar with type of cells coming from anatomy. Yeah, so you understand their functions better under immunology. Now, when you injure yourself, let's say a burn, for example, you're going to find out that there are some features that will occur. Okay, maybe you have a burn, maybe you have a scratch. There are some specific features which are going to occur. For example, you're going to experience some redness on your skin. Okay, maybe not for dark people. I have never seen any redness on my skin. Okay, so you find out that you experience some redness on your skin, and that redness is as a result of the vasoconstriction which occurs in your blood vessels. So once you have injured yourself, the first response that's going to occur under inflammation is going to be vasoconstriction. Why? Because we want to deliver more blood to the site where you have been injured. So as a result of that fast blood flow, you are going to find out that you are going to appear red at the site of injury, or in other words, it's called rubber. Okay, so rubber is just the dilation of blood vessels, which leads to the increased blood flow to the affected area, and there is what we call visible redness. Okay, so this is what rubber is. Then apart from that, you experience that there'll be some warmth. Okay, you begin to feel some heat on the site where you've been injured, and that is called color. Okay, so both rubber and color are due to increased blood flow. So that increased blood flow will lead to that red color. It will lead to heat generation as well. Then apart from that, there will be swelling. I'm sure we have all experienced swelling or tumor. So what happens is that when you have injured yourself, there's damage in the interstitium. Okay, that's outside the blood vessels. So what happens is that the neutrophils, they are found in blood, and all other cells that are responsible to take care of inflammation, they are found in blood, and they need to move from blood into the interstitium. So what will happen is that the endothelial wall of the blood vessels, it needs to constrict, it needs to reduce in size, so that to allow those cells to move through the endothelial wall into the interstitium space. Okay, so apart from those cells, what other material that is going to move outside those cells is going to be the plasma part of blood. Okay, so that liquid part of blood is going to escape into the interstitium, and the reason why that part of blood is needed is because it contains nutrients which the cells are going to use. Okay, so we are saying swelling or tumor. Inflammation induces the accumulation of fluids and immune cells, causing swelling or edema at the site of injury or infection. So apart from that, apart from redness, heat, swelling, you're going to experience pain. And pain, also known as DOLA, it's just a response due to stimulation of nerve endings. So that stimulation of nerve ending is due to chemical mediators which have been released by either eosinophils, it has been released by either histamine or other chemical type of mediators. Okay, so all these features, rubber, color, tumor, DOLA, they can lead to loss of function at that specific site of injury. Okay, so the inflamed area is inhibited by pain, while severe swelling may also physically immobilize the tissue. Okay, so all these features. So features of inflammation, there are four: redness, heat, swelling, as well as pain. Any questions before we continue? Fonso?
No.
No, is that a no or hello?
It's a no.
Oh, okay.
Viveka.
Vivek, that's a good sign. Okay, so cascades of events that happens during acute inflammation. So there's a series of events which happens. We have talked about the DOLA, we have talked about the tumor, we have talked about rubber. So those cascade of events, these fall under vascular changes of inflammation. Okay, so vascular changes of inflammation, they just permit the escape of leukocytes from the vascular system to the site of injury, increased. This is due to increased vascular permeability. So yeah, you experience rubber, you experience redness. So under vascular changes, you have vasoconstriction. Although this vasoconstriction is not prolonged, it's just transient vascular constriction for about maybe 8 to 15 minutes. Then after that, there will be vascular dilation. Okay, so yeah, you have vascular changes. Apart from vascular changes, you have the cellular events. Okay, so these cellular events are the events which are undertaken by a cell from the time it is deep in the blood until it reaches the site of injury by chemotaxis. So we're going to look at some series of events which involves the actual immigration of leukocytes from the vascular system to the connective tissue. Okay, so the connective tissue is where we have that inflammation taking place. So this cascade of events is acute. This cascade of events in acute is integrated by local release of chemical mediators. So I'd say that take note of the chemical mediators now, so that as you go into immunology, you're able to understand them. Yeah. So number one, vascular changes. So vascular changes, number one, there is vasodilation. And vasodilation is just after a transient vasoconstriction. So it occurs through the release of mediators from cells, which include histamine. We have prostacyclin, which is prostacyclin 2, and also nitric oxide. So to take note, histamine and prostacyclin, these two, you do not need to forget these two, histamine and prostacyclin. Okay, so take note of those two. The nitric oxide, if you want, you can forget. That's up to you. Okay, so vasodilation is due to release of such chemical mediators by the inflammatory cells. So vasoconstriction before vasodilation occurs, it will only happen for about 8 to 15 minutes. Like we mentioned, it's a transient vasodilation, meaning that it won't last for a long period of time. Okay, so vasodilation increases the hydrostatic pressure by causing slowing or sludging of blood flow. Sludging of blood flow causes migration or margination rather of leukocytes along the wall of the blood vessels. So initially when cells are moving through blood vessels, they are going to move in between. I'm sure we know that law of physics. Okay, so in between of the blood vessel, that's where the cells are going to be moving from. But then if there is vasodilation will cause slowing of blood. So after there's vasoconstriction, that blood has moved fast to the site. Okay, it's still in the blood vessels. Then what will happen? There will be sludge. So blood will move at a slower pace, and this is to help those cells to move closer to the endothelial wall, so that they can find themselves out of the blood vessel. Then we have increased vascular permeability. Okay, so increased vascular permeability, from what we are saying here, we just mean that the permeability of the endothelial wall increases, and it increases because there will be constriction of those endothelial cells. So to allow the permeability of the plasma fluid as well as the cells of inflammation. So the type of mediators which will lead to increased permeability include, we have histamine as well as leukotrienes. So when talking about inflammation, always histamine should never miss in your statement, because histamine is an inflammatory mediator. It's always there doing its duty. Okay, so two things are going to happen. We have talked about two things: vasodilation under vascular changes. You always have to remember vasodilation. Okay, don't forget the chemical mediators, and don't forget what's happening here. So vasodilation, then you also have increased permeability. So these two, you know how they are happening and why are they happening. So you know the how and the why. Okay, so mechanism in increased vascular permeability include, so I've talked about contraction of the endothelial cells. So as we can see from this diagram here, we're able to see that my top left diagram here is showing a normal blood vessel with less permeability. Then as we move from my left to my right here, we can see that this endothelial wall begins to open up. So as you can see here, it begins to open up, and after it opens up, those blood dots, they're able to find themselves into the interstitial space, and this is the function. So after that happens, it's going to go back to its normal size. So it means that, okay, we have enough, maybe this will work. Then those cells which have moved into the interstitium, if they fail now, that's when chronic inflammation can happen. So yeah, so under contraction of endothelial cells, so the contraction of endothelial cells increases the intercellular gaps in the venules and capillaries, which lead to increased leakage of fluid into the tissue. Okay, so we want fluid, we also want cells. So this is mediated by histamine, bradykinin, also lipoxins, and other chemical mediators. So between the three chemical mediators, amongst these three chemical mediators, I would say no histamine and no bradykinins now before you go into pharmacology, because you are going to find these as well. Okay. All right, I hope someone is getting something background. Okay, so after the endothelial wall has contracted, it needs to go back to normal, like we have stated, and that process is mediated by the tissue necrosis factor as well as interleukin 1. Okay, so these two are going to mediate the endothelial cell retraction reaction so that it goes back to normal. We have enough fluid. We do not need to lose any more fluid. Yeah, I know there are a lot of mediators, but as compared to immunology, this is nothing. Okay, injury to endothelial cells. So if you have a burn direct to endothelial cells, yeah, I'm just asking for a minute. I pick up this call, it's quite important. I'll be back. Sorry.